At our July call, thank you all for introducing yourself. It was myself, Lisa Johnson, Rebecca Drummond, who is our grant writer person here at Archie Hendricks, Teresa Holt, who is an ombudsman in the state of Alaska, recruited by Lisa, Jonathan Collins, and Julie Cahoon from KAI. So anyway, we again talked about the role of KAI as he just mentioned, as Tony just mentioned. We did want to try to get NICOA on the call. I'm sorry I didn't get a chance to email Randella, but I did invite her to this call when I sent out the invite. We talked about getting more information about tribal perceptions of nursing homes. I did get the list from Teresa Holt on the assisted living homes in Alaska, and I gave that contact information to Tony Curtis, who will be adding that to the U.N.I.T.E email. So we're going to try to make the email so it says U.N.I.T.E instead of PREACH, which was our first name or acronym that we came up with. We did get an update on our grant. We did not get the HRSA development grant that we applied for, but we have another option to apply this fall, and we'll talk about that. We talked about our annual meeting, which we'll need to talk about again today. We did add a Title VI staff member. Her name is, Tony, do you remember what it was? Kristen Hutchins, is that right? Kristen? I think it was Kristen. She was referred to us. Yeah, she was referred to us by Cynthia LeCount with the Administration for Community Living. So our formal contact, Sheila, just FYI, is Dr. Bruce Fink with Indian Health Service, John Johns with CMS, and Cynthia LeCount with the Administration on Community Living. So, let's see. We talked about the GWEP. So in case you're new or don't know, that's the Geriatric Workforce Enhancement Program. You can Google it and see where that funding is across the country, usually affiliated with a university. I'm actually adjunct faculty on the GWEP with the University of Arizona in Tucson, Arizona. And so we get a lot of resources from them. And in fact, they sponsored our last two annual meetings. So we continue to work with them. And then Lisa had forwarded some information on REACH into Indian country. Lisa, that's also a HRSA grant, correct?
I'm not sure. I think it came out of the VA. It came in the VA, but I'm not sure where the funding came from. I know it's free.
Yeah, I don't have the paperwork right in front of me, but this is the third year of their 3-year grant. So Barbara Higgins at the University of Tennessee is coordinating this right now. We were able to reach her, and in fact, I've got training scheduled for 11 of our staff next week with her. So it's basically a 3-hour webinar that she does with them, live webinar, and then she sends all the materials. And what it's training them to do is to be certified, to be a coach, to go out and either talk to other staff, talk to the community, whatever. So it's kind of a train-the-trainer idea. But I'll let y'all know how that works after next week. You can actually split that 3 hours, too, into like 2 1.5-hour sessions if that works better. If anyone's interested, just let me know. I'll be happy to send you Barbara's information. So that was our meeting on July 20th. And is there any corrections to those minutes or anything I need to add that didn't get in there right? Okay, so I'll put that the minutes are approved as read. And then we're going to go on now to our new members. So Sheila, would you, since you're kind of the only administrator really on the call, do you want to just kind of talk a little bit about what's up in your world and what's happening? I know you're here to learn from us, but you're the only administrator on the call, so.
Deb?
Yes.
Okay. Since I've been here, of course, I've learned a lot about the culture here, and the different. This is a different environment for me because right now we are not doing any Medicare skilled services. We only take Native residents, so I'm getting a little used to that, but. it's okay because I kind of like it that way. But I think some of the challenges I have is just staffing, of course, and for me, just the building is, we have an old building. We're working on that, but I mean, it's a good place here, and we have very good people here, and we're eager to learn and grow.
Are you dealing with the new mega rule, with some of the new things that are going into effect in November, the phase 2?
For the new regulations?
Yeah, with the phase 1, phase 2, phase 3. Is there anything that you're working on specifically with that right now?
Well, I mean, of course, we're looking at infection control, and I think there's some things with the MDS that's changing. Is that what you're referring to?
Yeah, it's like the care planning, the MDS being like the care planning being like resident focused, that kind of stuff.
Yeah.
Okay.
We just had our survey, and we're now a 4-star facility, and I'm hoping that once the survey gets loaded in, that we may move up a star. I'm not really sure, but we've got good QMs here, and we're working on that. But we're on the Advocates program too to kind of help us with that.
Well, that's good.
Yeah.
Could you tell us what the Advocates program is?
The what?
Could you tell us what the Advocates program is?
Well, the Advocates is kind of a web-based program that, you upload your MDSs, and it kind of gives you an idea of where you stand with things that could flag for surveys. There's a tool on there for customer service, resident family interviews, staff observations, and that's kind of like, there's like different phases to it. Phase 1 is that, and phase 2 is getting all your MDSs loaded, and then it helps you with your QAPI program.
Okay,
based on what
great.
you're inputting.
Great. Is that like an MDS? I'm sorry, go ahead.
We're just now implementing the Advocates program here, so we're getting started on that. But
Is that kind of like the MDS scrubber, like where it scrubs your MDSs?
No, that's the TSI. TSI is a program that, yes, you input your MDSs in there, and they will scrub them for you. It's really good if you're using Medicare because it helps you get the highest drug level. But it also looks to see if you've got any alerts and kind of lets you. It's really a pretty good tool. It kind of helps you see if you're trending toward a higher acuity level, or it can even kind of zero in on particular quality measures. But it also has a section on there that kind of helps you guide yourself into how you can get to a 5-star rating. Yeah. So
the Advocates does?
That's what the TSI does. Advocates doesn't really do that, as far as I know.
Okay.
Advocates is more survey related.
Okay.
Sheila, this is Lisa. Oh, sorry.
Oh.
Melissa, I think you were talking. Go ahead.
Okay. Sheila, this is Melissa. A couple of the, either the nursing homes here in Alaska or some of the tribal assisted living facilities, we're talking about staffing issues in regards to recruitment and then retention. What are you experiencing as far as staffing issues, and how are you working to resolve whatever issue it is?
Oh boy. Well, I mean, believe it or not, and I'm going to cross my fingers and my legs and everything, we are very well with nurses. I'm fully staffed with nurses, and we haven't used any agency. We do have an issue with CNAs, and I think every nursing home across the country does, but our management company was doing their own CNA training program, but they've discontinued that. So now we're going to have a challenge for new CNAs. We do draw on the Pueblo a lot for staff. We do have some Navajo that come in from the Gallup area, and we do have some that come from Albuquerque. And I think that a lot of, and I've recently done a lot of one-on-one listening sessions with them, and I think that the people that work here, they want to work here because of the grandma and grandpas. They want to feel that connection to them. And I think that the Pueblo offers pretty good benefits for them. But we work on morale issues, and I want to, for next year's budget, I want to look more closely at pay and, some other incentive programs. But we're not totally isolated like some of our other, organizations, but we're 50 miles from Albuquerque and about 80 miles from Gallup. So we're not totally isolated, but enough that it's a little bit of a challenge.
Mm-hmm. This is Lisa, and I was just gonna add a little bit. I put out a newsletter for my nursing home group, and I interviewed one of our nursing homes in our last issue and talking about a quality project, and they did a big project on retention, reducing staff turnover, and it made some big gains. And one of the things in that conversation, there was a couple of things that came out, but the one that struck me that I thought was very interesting is they found that they were losing a lot of good people, and in that initial period of time when on the hires. So they did a lot to sort of, in the interim, from getting that welcome letter to starting work to continue a relationship with that new employee. Did a lot of recognition around new employees. But one of the things that the administrator said that I thought was really interesting is he said the biggest impact on their retention was in holding people accountable. And when he said that, I kind of got a little shudder up my spine. Usually when you hear, I'm holding you accountable, it's kind of in a negative context. But he said, what we're finding is that by holding everyone accountable to that high level quality of care, you're coaching and supporting those low performers, which makes those high performers want to stay. That, by getting sort of, if I'm a really hard worker on the floor, I'm going to get pretty sick and tired of carrying the weight of the unit. And that was sort of where the work that they did. So I'd be happy to share the article if you guys are interested. But they did a really good job of looking at their data. It looks like they improved retention from about 57% to 70% and reduced turnover from 63% to 43%. So they had some good results.
The thing that I would find, yes, I would like to. The thing that I also find challenging here is that's different for me is a lot of people won't be honest with one another, and it's hard for them to communicate openly with one another, and I'm not sure if that's if it's a cultural thing or they just don't want to. I don't know, but I'm going after I had my listening sessions. I've narrowed things down. Their biggest concern is teamwork and communication. So I am going to start some CNA support group meetings where I want them to be open with each other. I want them to praise one another, and then the next thing I want to do is I want them to have fun with one another. I want them to go out. We're going to go out and play laser tag or do relay races or something. Just some sort of really team building exercises. But I want them more importantly to open up to one another and do it in a constructive way. So we can build on that teamwork. We all talk about it, teamwork, and accountability, but, to me, actions speak louder than words sometimes.
Yeah. Okay. That's really good, Sheila. I so appreciate what you just said. And Lisa, if you want to send me that report, then I can send it out with the minutes, and I'll put like a note on there kind of about what we talked about.
Sure, it's just my newsletter, so I'll have to send you the whole newsletter, but I'm happy to share.
Yeah, that would be great. I like what Sheila just said about kind of opening up constructive communication, too, because I teach a lot of, we talk a lot about in training, too, that comes up with QAPI and, performance improvement, that the root cause is oftentimes communication. And I say you cannot not communicate. Even if we all stop talking on this call, we're still communicating, Just the fact that you're not talking, you're communicating something. So I said you cannot not communicate as a human being, as a living, breathing human being. So we have to think about all the time, really, how we are communicating. And obviously there's different ways, but I like what you said, too, about opening up kind of that constructive communication, like how do we build each other up, right?
Right, because,
kind of thing.
They need to learn to be able to say, it hurts me, my feelings when you do this, or I don't understand why you don't help me. They need to be able to open up and have a real honest dialogue. And right now they're not doing it. They'd rather write it down and slip the note under my door, and I can't deal with all of that. So we're working on it.
I have a great quote for you, and it says, "What you do speaks so loudly that I cannot hear what you say." That's a Ralph Waldo Emerson.
Wow.
Oh, let me write that down.
Isn't that a good one? Yep. What you do speaks so loudly, I cannot hear what you say. Ain't that the truth?
Yeah.
Yeah.
Emerson has it going on.
I can't hear what you say. Yes, Ralph Waldo Emerson. Okay. All right. I'll write that down. All right. Very good. I want to, keep an eye on the time. It's about 12:30, and that's perfectly fine. We don't have any speakers today. We did do our survey, Monkey, and I appreciate Lisa's help with that because she took some time out of her morning a couple of weeks ago to help me put that together. I did send that out, and Lisa, I didn't check before this meeting, but I think I had about 6 or 7 responses. So I think, should I go ahead and send it out again? I think maybe to give them one more week. What do you think?
Yeah, and there's when you go to resend, and I can talk you through it too if you want to, go into the survey, and if you can figure out resending to those that haven't responded, great, do that. If not, give me a call and I'll walk you through it.
Okay, if you want to stay on this call just for a few minutes, when we're done, we could just do it then, if you want.
Yeah, sure thing.
Okay, then I can just get it done because I got 6 million other things as usual. Okay, so that'll be good. So why don't we have a little report from Lisa then with the QIO, how things are going in the QIN world.
In Alaska, I guess the news is I did get the REACH certification, so I am trained to provide this resources for enhancing Alzheimer's caregiver health in Alaska, and I'm excited about that. I'll be meeting with an individual next week to provide some supports. The other thing is we've got dementia training free for free in Anchorage in October, and then in January we're going to have Tifa Snow's Train the Trainer group come up and do training, tapping into CMP funds or civil money penalty funds to make that happen for my nursing homes and cover the costs. So I'm hopeful that will really help those direct caregivers just get some more real practical hands-on tools for dementia care. And that's what we got going on here.
Lisa, is Tifa Snow actually coming herself?
Oh, I wish. No, her trainers. She's got a couple trainers coming. It'll be a train the trainer workshop, though. So when folks leave that training, they will be certified as a positive approach to care trainer and can go back into their organizations and do ongoing dementia training.
Okay, excellent, because I've spent the whole month, basically we have Relias online learning for all of our staff. We've had this for like 6 years. I mean, it's not new, but all Chifa Snow's stuff, quite a bit of her stuff is on Relias. So I've been using that for training, and I just got approval to start showing it in our morning meeting. Oh, someone's got a train going by. I hear the train. So Chifa Snow is very good. She's, a national expert on dementia. I actually looked at her GEMS, GEMS, where she relates the stages of dementia to you as a caregiver are a sapphire, and then there's emerald, amber, rubies, diamonds. Let's see, diamonds.
Really cool, yeah.
Yeah, it's really good. Diamonds, emeralds, amber, ruby, and then pearls. And so, actually, Lisa, what I was thinking of doing when I show that little webinar that she did on that is to go out to the dollar store and buy some little, how the kids get fake jewelry? And just buy some little fake, rings that look like sapphires and say, okay, we're all sapphires here, and just kind of implement that in a more, concrete type of way. So, but if you get Reliance, or if you can Google Teepa, Teepa, SNOW, like snow, it's going to snow in the winter. It's wonderful. I love her stuff. And she really does. You focus not so much on the task, it's on the relationship. And that's, I think, a really good way to look at dementia. So.
Yeah.
All right. Thank you, Lisa.
Yeah, and I was just going to say I would encourage anyone that's having challenges around dementia to look at the YouTube for Teepa Snow. She's got lots of stuff out there, and you can't get any better than that.
Yeah, I agree. So very good. And then, Joseph, you want to give us just a little kind of your world in the board, being on a board? Any follow-up with the webinar we did in July? Did you get anyone contacting you? Or
no one has contacted me other than the follow-up with Kaufman. But I had a question, though, to Lisa and maybe to Melissa regarding dementia and memory care. That are resources that are not only nursing home based but community based. We're having our New Mexico aging conference here these past 2 days. That would have been Tuesday and Wednesday, and I did pick up a brochure from U.N.I.T.E Hospital, which is about 50 miles from our facility. But I'm wondering. And I know that Rainbow we have our activities director, and I know she works with our residents on memory, but I was wondering if there were any resources to enhance those departments somehow, enhance memory care somehow through activities.
Joseph, that's a great question, and I have, it took me a while to find this little gem, but every state has what's called CMP funds, civil monetary penalty funds. So when they go and inspect nursing homes and they find deficiencies, they levy these penalties, and that money gets put into a bucket that can be used. It has to directly improve resident care. So I'm actually tapped into our CMP funds to cover this Teepa training for my state because, again, this is something, the money is going to go directly back to supporting those residents. If you want, I can send you just a link or some info on those CMP funds. But I looked state by state. There's, in fact, if you Google it, I think there's a document out there that shows each state that's tapped into these funds and what they've done. But there are several that have used it directly for like music and memory, memory activities and things like that. So that might be an option for you.
Thank you.
Yeah. Can nursing homes request that, though, or do you have to be like a QIO to request that?
Any nursing homes can request it. There are guidelines, and like I said, it's very black and white. But if you're improving the lives of your residents, and there was a couple that did things for the resident councils and activities and things like that, Looks like it's fair game to me. So I will send, if it's okay with you, Joseph, why don't I just go through Debbie? I'll send everything to Debbie, and then you can share it with the whole group in case there's anybody else that might be interested.
Yep. I'll forward it right away to you, Joseph, so you have it right away.
Well, if you could also, forward it to Sheila, because again, we have resources that we can leverage in our community that properly packaged. I think our tribal council would be willing to fund us on various specialty programs to improve the quality of life for our community elders as well as those that are at the nursing home. And so,
Joseph, I've already talked to Malcolm about doing some grants for us, and I do know about the CMP program. Yeah.
And also, there was. Oh, I'm sorry. Go ahead. I was
just going to say, if I recall, when we toured last couple years ago at Archie Hendricks' home, correct me, Debbie, but you guys, there was a whole room dedicated to sensory enhancement. If I recall, that was a full room.
Right, that's our snoozling room. Kind of unusual, actually, to have that with elders. But it's SNOEZELIN. And there are some articles on the internet about the use of snoozling rooms, multisensory rooms.
One thing that I know that really stirs memory at our nursing home is these pictures, photographs that were donated about 20 years ago by one of the local photographers, Mr. Marmon. They are scenes of years past at Laguna Pueblo, and I know that when our residents see those pictures, and they're on the wall at our facility, they stir those memories of those people and those times. So again, I'm just hoping to add to our services or enhance them in any way that we can. So thank you.
I think that's a really worthwhile goal. Thank you. I'll put that down. Tony, you want to give us a little KAI update?
Yeah. So what we've done so far is, are you talking in regards to the outreach for your guys', so then the last LTSS webinar, let me start there. So Joseph, we sent out a thank you email providing all of the resources and outreach from your last LTSS webinar where the U.N.I.T.E Nursing Home Collaborative presented. In addition to that, Debbie and I just started what we're doing, which is the organization of materials, call information, and resources going forward for the Nursing Home Collaborative monthly calls. So that's where I'm at right now. We did send those out for LTSS. And then the Nursing Home U.N.I.T E, you guys have had some updates to your guys' website as well, the Nursing Home Collaborative and the U.N.I.T E on the cms.gov website. So all of the recordings, to the best of my knowledge, are posted. We're through September 15th, so I think we have a few more to do, actually, don't we, Debbie?
Yeah. So those are the recordings of these calls or of the webinar.
Yep. No, that's
of these calls. Are we good through July? I haven't looked today. Did you post the call from July that we had, July 20th?
Yes, it is posted up on the website.
Good, excellent. Okay, and I think there's a feed, so it's our website, in case you haven't looked recently, is tribalnursinghomes.weebly.com. It's on our brochure. And if you look, there's an RSS feed, right, Tony? So anything I send out by email to the TREACH email, it's going to show up on that website. There's a whole listing of any time I send something out, it's connected that way.
Correct.
Okay. All right. And how are we doing on our best practice paper that we agreed to publish quarterly. Is the most recent one up yet?
Were you working on that with Julie?
Well, yes, but I thought you might know. So just for everyone on the call, we actually had two topics this year that we were focusing on. One was dementia, and one was how nursing homes work with boards and with tribal leadership, okay? So we agreed, we told CMS that we would every quarter, once every 3 months, we would put up a best practice paper, and it would be posted on the cms.gov website under our little section there. And so we've done
right.
Two have been posted so far, right? One last fall and then two more this spring. And the third one, I think, was supposed to be posted in August, right?
So currently in that best practices section, you have a PDF for traditional foods, and you also have a 10-page PDF on dementia and Alzheimer's disease. So we have a third one that I need to follow up and find?
We never got the one up then on tribal relationships. That one hasn't been posted yet.
Okay, I can follow up on that one, tribal relationships, best practices report.
Right, because that's the one that Julie called. Julie called quite a few of the administrators and did telephone interviews, and some people gave her feedback, and she was going to pull that all together. Last I heard, it was needing to be approved by CMS before she posted it. So I'd like to see it. If she's got a draft, I'd like to take a look at it before it gets posted.
Okay, so Julie's currently out on annual leave, just to give you a heads up, but I will follow up with her as she returns to office, and she's lightly checking emails right now. But I'll give you an update on that later this week, okay? Actually, today's close to the end of the week, first thing Monday.
Okay, and just so you all know, Tony, Curtis, and I have another call scheduled for September 5th to follow up on the work we're doing with the calls and the emails. So by our September call, which should be the 20th, it looks like. Is that right? It's the 21st is the third Thursday, Tony. You should be able to send out the invite by September, right?
Correct.
Okay, so we'll start getting invites and reminders from Tony. I don't know if you guys on the call have any thoughts. We didn't want to send out too many reminders. Lisa, you're pretty good at this. Maybe you could comment. We didn't know if we should just send out a reminder like one day before and maybe 1 week before and then 1 day before. Do you guys have any thoughts on that? Because we didn't want to bug people too much.
You can send out as many as you want.
Okay. All right. So I guess, Tony, just go with what we talked about. I think we said like a week in advance, 3 days in advance, and 1 day in advance. I think, isn't that what we said? I can't remember.
That was the thing we were. Go ahead.
I was just thinking that 3 reminders might be a little much.
Okay.
But that's I'm one of the group. I don't know what everybody else thinks. I'd be good with 2.
Okay. So maybe Lisa 1 week ahead and 2 days ahead, something like that.
That's my feeling, but I don't know what the rest of the group. I'm just one in the group. But yeah, that sounds good to me.
Anybody else? Anyone else have strong feelings about that, one way or the other?
No.
I have strong feelings that 2 is good enough.
Okay. All right. Well, all right. We're going to go for that then, Tony. And so let's just go for that. Just do 2. Do 1 a week in advance and 1 like 2 days in advance. And I think we'll try that and see how it goes. Okay. So we will report on the SurveyMonkey as soon as I get a few more responses. I'd like to try to get a few more responses. We're running kind of low on time here, so I want to give you a couple things. On the T-Tag call, there have been some updates to our section of cms.gov. Go to Outreach and Education, go to American Indian, Alaska Native, and then go to the Tribal Technical Advisory Group, and you will see the U.N.I.T.E. They posted 4 new videos. I watched a couple of them. They are on YouTube. There's one called Traditional Foods for Tribal Elders. There's one called Dementia and Alzheimer's Care for Tribal Elders. There's one called Home-Based Care for Elders and Tribal Members and Disabilities. And there's one called Financing Tribal Long-Term Services and Support. I did watch the one on traditional foods for tribal elders. It was very short, like 2 or 3 minutes. So I don't think these are long, but they are on YouTube. So I will send out the titles, and you can go to YouTube and check these out if you don't want to go to the CMS.gov website. I also have Nicole O'May from Banner Alzheimer's Institute had come out to our facility a few weeks ago. She brought a woman from Western Australia University who works with the Aboriginal folks in the Kimberley region. And she did a presentation for our staff, and she also gave me some YouTube videos. One of them I watched, which is really, really good, called Love in the Time of Dementia. If you have a time to catch that on YouTube, it's worth it. I thought it was very well done. Love in the Time of Dementia. It's a YouTube video. And I'll post those too. I'll send those out with a minute so you guys can go to those if you want to, okay? I did want to mention really quickly, before we talk about our annual meeting, that our phone number here at Archie Hendricks is actually changing. And I don't know, Melissa, if you have the ability to update that brochure and reprint or not, but our phone number will be changing on September 6th to 520-585-5500, and we're also going to have a toll-free number starting on September 6th. So I will put that in my email, too, for anyone. Melissa, do you know if we could update that brochure and reprint or not?
So I'd have to look at my budget. I do have some flexibility. Can you repeat that number to me again?
Sure. It's 520-585-5500, and the 1-800 number is 777-0776. That's the 888 number. 888 number. And that's as of September 6th, Melissa, the 6th of September.
Okay. I will, I'll let you know probably by tomorrow.
Okay, that's no problem.
Yeah, but I believe I have enough flexibility in my budget to
print out a new one.
Yeah, how many did we get printed last time?
I think you did quite a few because we were going to, was it NCAI when you printed those out? So I think you did quite a few, and they're out there. The thing is, they're distributed. What we might want to do on this one is put a date on it. You know what I mean? Some kind of publishing date so, you know, people know if it's 10 years old, the kind of thing. I think we should put some kind of date on it.
Is there anything that we need to change in it before I get them, other than the phone number? Is there anything else?
Let's do this. Let's change the phone number and then send it out to the whole collaborative and say, what else would you like to see on here? I think we should talk about that on our September call. Let me put it on the agenda for September, and we'll see. Because we've been out this a couple of years, so things might have changed. Okay.
And if I can, because the end of our FY17 is September 30th.
Ooh, okay.
I can.
Well, if we made definite decisions at our steering call, that would be Monday, September 11th. Then would that give you enough time?
Yeah, I could. I would just have to send the email because I'll be at the Title VI conference, but I'll have my laptop so I can send information. You know, via that. Yeah.
Okay. Will you be able to be on that call on September 11th?
I might be in between flying somewhere.
Okay. Okay, because I don't want to pick a time where you're not available. Maybe we might have to send it out and just try to get feedback from people and then just go with that then, because we want to hit the deadline.
I'll be out that couple weeks then.
Oh, you won't be available on the 11th?
Yeah, if you want to send it out, that might work better for me, anyway.
I'll be on travel also that day, Debbie. September 11th.
Okay. All right. So then the last thing, and I'm sorry we didn't leave very much time for it, is to talk about our annual meeting. So what we decided at the steering committee, Melissa put together a save the date card, so I appreciate that, Melissa. We decided based on the survey results to have it here in Arizona, and it's coming up. It would be Thursday, October 19th, and Friday the 20th. So the 19th is at the Casino del Sol Casino in Tucson with the Pacoyaqui tribe, and they are hosting the Banner Alzheimer's Institute one-day conference. So let me just quickly share with you. I think I sent the brochure out to everybody. So I did get an estimate from them on what they could do for us depending how many people we have. What we decided is we'd need to have at least 10 people to do this. And the agenda for that day is topics such as how to get help, diagnosis and treatment, understanding the stages and progression, simple communication tips, dementia portraits, finding meaning in caregiving through the creative process. And it's just a one-day, starts at about, 7:30, breakfast, 8:15 at start. Then what we were thinking, and I have a request into our board, is to have everyone come out here to Archie and have in the morning breakfast and our annual meeting and meet with Rebecca Drummond to talk about our development grant and see if we can flesh out some of the feedback we got from the grant people. And then maybe in the afternoon go out to the Cultural Center, which is a little bit south of Sells, or do a little hike or something. The weather that time of year is usually pretty good out here. And then people could either fly in Wednesday night and fly out either Friday night or Saturday morning. You'd probably need 2 or 3 nights. And the lady at the casino is willing to block us out a few rooms. So I did get a quote from them. The room rental fee per day is $250, so we just need that one time. And that could be poolside or in the dining room. This is our dinner for Thursday night. I thought we could just have a kind of a mixed dinner we talked about without having our formal meeting that night. 10 guests at plated dinner at 10 guests would be a total of $380. 20 guests would be more like $800, and 30 guests would be more like $1,200. So the totals depend on how many. So if we have 10 people, we're looking at $781.30. If we have 20 people, we're looking at $1,310.50. If we have 30 people, $1,829.40. So it just depends. So anyone have any thoughts on that? I mean, we did have some people say they would come, and especially people in Arizona, New Mexico, but I think there were some other members who said they would come too. Anyone have any thoughts on that?
I guess, Debbie, my question would just be of the folks that you've heard back on the survey, 6 or 7 folks, are they all planning on attending? Do you look like you're going to be able to hit the numbers?
Right. These are the ones that said they would attend. So, like I said, we have about 6. But last year we picked up people when we got there that there were people that were interested in joining the collaborative, and so we kind of brought them on board. But I am going to have to talk to the University of Arizona, because there'd probably be a cap at some point, I'm going to have to let the U of A know pretty quickly if they're going to, agree to it. My thought was maybe they could just host the dinner on Wednesday night or on Thursday night, the mixer dinner.
Sounds good.
And I think, those of you on the steering committee, do you remember we set a deadline for response? Do you remember what we said?
It was September 1st, right?
Okay.
So that's why you have to create the save the date card.
Yeah. And I haven't sent it out yet because I wanted to make sure that what I was talking about was even possible, because I hadn't had I finally got a hold of the board of Francis Stout, last week and asked her, what she thought about this. So, and I forwarded her a bunch of information. But I think I'm going to go ahead and just send it out and say, look, this is what we're, tentatively planning. We just need to know, would you come for 1 day, 2 days? I think it would have to be 2 days, because the conference would be the first day, and then the meeting would be the second day. Now, we'd essentially be done at noon. You wouldn't have to stay for the Friday afternoon. If you wanted to fly in Wednesday night or come in Wednesday night and come back on Friday sometime, we could essentially be done by noon if we needed to be. Okay, so I'm going to go ahead and send that out, and hopefully, especially like Joseph, you were saying, people in Arizona, New Mexico that are close will definitely commit. And then we will have a phone line, Tony. We'll probably need a phone line for that annual meeting on that Friday to allow people to call in.
Okay.
Some kind of line where people out of state, if they absolutely can't make it, they could call in and be part of that annual meeting.
Well, we will work on a solution.
Okay, and I did talk to Rebecca, our grant director, for the 20th, and it looked like she could help us on that date, that she could come and meet with us on that Friday. All right, that's all I have. Anyone else? Any other business or any other things we need to discuss? Okay, so Lisa, you're going to send me those resources, and then send me what you have on the minutes, and I'll get these typed up, okay?
All right, and I'm going to hang on the call with you, okay?
Okay, thanks, Lisa. I'll log on then. Thanks, everybody.